4 levels to sedation or to general anesthesia. You have mild sedation, moderate sedation, deep sedation, and then general anesthesia. This is a common question we get on our anesthesia boards. And these are general things that people who are providing sedation, such as sedation nurses and others, need to be aware of. Mild sedation is defined as having normal response to verbal stimulation. So if I speak to you, you respond back. Additionally, you maintain your airway reflexes, you maintain your own blood pressure. Essentially, you're maintaining your normal bodily functions. Moderate sedation is defined as having purpose response to verbal or physical stimulation. It's also defined as having mostly intact airway physiology, meaning you're still breathing on your own, and that your cardiovascular function, pretty much your blood pressure, usually is maintained. Now, one of these might be a little off, and that's okay. You still may be in moderate sedation. Deep, purposeful response to repeated or painful stimuli. Deep sedation is defined as purposeful response to repeated painful stimulation. Deep sedation is defined as purposeful response to repeated physical or painful stimulation. In this instance, spontaneous ventilation may be compromised. You may need to assist the person, such as with a jaw lift. Cardiovascular function is usually maintained in deep sedation. Once you've exceeded deep sedation, you go into general anesthesia. So if the patient becomes totally unresponsive, regardless of the painful stimulus, if the patient stops spontaneously breathing entirely, and you have to put in some sort of advanced airway, or if the patient's blood pressure is requiring continuous and ongoing support, and some of their other aspects of responsiveness and airway management are requiring more support than standard, you're probably in general anesthesia. And when it comes to medical legal reasons, if you are doing deep sedation, you need to be prepared to rescue that person from general anesthesia. You always need to be prepared. You always need to be prepared for the next level of sedation if you're providing any level of sedation.